Welcome to today's episode of That's Orgasmic. I'm Emily, a sexologist helping you navigate the orgasmic and not so orgasmic moments in sex and relationships. Today I'm joined with Dr. Maria Sophocles, who has been a practicing gynecologist for 29 years and is an internationally respected expert in menopause and female sexual function. She's the founder of Women's Healthcare of Princeton, a progressive gynecology practice serving over 30,000 women in the US. So welcome to That's Orgasmic.
Thank you. So glad to be here, Emily.
Today, I really wanted to chat about a few things, one of them being the bedroom gap, a term that you often speak about, then sex as we're going into midlife, and also menopause. Now, before any younger listeners turn off the episode because they think it's not relevant, I guess me and Maria really wanted to emphasize the importance of learning about this now, whether you are a man, a woman, non-binary, trans, whoever you are. I think it is really important for us to learn about our bodies, and if we're dating somebody who is one day going to experience menopause, what that is like, how we can connect with our partners, support them, and also keep our sex life alive. So I would love to start with, why should we be learning about menopause at any age, really, and particularly before we even reach that point?
Yeah, so there are sexual reasons to learn about it and non-sexual reasons. The non-sexual reasons are that every human who goes through menopause, and that means every human with ovaries, right, is going to go through menopause. So trans men are going to go through menopause assuming they still have their ovaries. And when you go through menopause, there are health changes in a negative way that develop. Heart disease accelerates, brain function deteriorates more rapidly, bone strength deteriorates more rapidly, muscle mass gets lost, fat takes its place. So lots of changes happen. They're not all good, and many of them are silent. So I think it behooves pretty much everyone to understand this so that either you or someone you care about who's going through this, you can say, gosh, you're my partner. I live with you. And I want to make sure you know about these changes so that you and your clinician can prepare for them. The sexual effects of menopause are pretty dramatic as well. And because I care a lot about sexual health, and I believe that staying sexually active longer is linked to happiness and longevity, which isn't just me, that's been proven in studies. I think that it's important for all people to know what happens to our bodies as we age in terms of sexual effects. And men have effects as well. So people kind of joke and say there's something called menopause also. And in medicine, we call that andropause. And that's just a similar age-related drop in testosterone with similar effects in terms of libido and hair pattern and muscle mass and things like that. But in women, the effects of menopause also include a really dramatic drop in estrogen as well as testosterone. So when we lose estrogen, the vagina itself has really dramatic negative changes. And if you put a link to my TED Talk, there's a cool animation in it of the vagina losing estrogen, and you see the walls of the vagina go from thick and juicy and red and ridgy to sort of flat and pale and inelastic, no moisture. And it's really important that both men and women understand this change so that if your partner has pain, it's not just that they'd rather watch a TV show. It may be that there are really effects of the lack of estrogen happening. These effects are so easy to treat also. So I think that's something also worth saying, that the treatments for this estrogen loss in the vagina are safe, are available, are effective, can be used for the rest of your life. And I mean, these are just things it's so cool to know so that you don't suffer in silence as a patient, or you don't wonder what the heck's wrong with my sex partner because she won't talk about it or they won't talk about it. And, sex, as you know, Emily, many people are just not comfortable talking with their partner. They'll talk about
No.
taxes and education and their kids' school grades or the fact that they have to sell their car. They talk about everything together, but not about sex. So you and I can hope that we can empower people to talk about sex, and maybe even on this podcast episode, we could talk about some ways people can begin conversations with a partner. But I think it's important for every individual to understand what happens to the female genitals when we take that estrogen away in menopause, which, by the way, begins around age 50, 51. And by age 57 or 58, something like 50 to 70% of women have real symptoms, or I should say, humans with vaginas have real symptoms of pain, dryness, itching, burning. The phrases, women tell me it feels like there's a cactus in there. It feels like shards of glass. It feels like it's on fire. I mean, not subtle things, like really painful things. So, anyway, that's why I think it's kind of important at any age to at least know that. I mean, nobody tells you that when you're in school or uni.
No,
There's no
definitely not.
health class that says this is what's going to happen. And I kind of feel like there should be. I mean, it'd be so cool if we could just think if we could disrupt and change sex ed so that even kids kind of understood a whole lifespan so that they could say, okay, this is what sex might be for me at 20 and at 30 and at 40 and at 50 and at 60 and at 70, and to destigmatize sex, that it's a wonderful, beautiful connection at any age. The movies kind of makes you think sex is something you do from age 16 to 40, and then I guess you just wither up and die. But in real life, people keep having sex. It's not very glamorized by the movies or TV, but it's a thing. And, hopefully it's a really good thing for people. So,
It's
yeah.
something that really isn't spoken about. I did not learn about it at all in my education until I was doing my sexology degree. And I would just remember being like, why are we not talking about this? Like, it feels like this scary thing that is going to happen to us that we have no control over, and we're going to have all of these terrible symptoms, our sex life's going to die, and that it's just, yeah, it's this not enjoyable experience that we should kind of fear
And
almost.
some people, it's really, really like life altering in a negative way. But I would counter that to say for some women, first of all, some people don't have many symptoms, but for many people, it's an opportunity to really look in the mirror and say, okay, I am 50. The average lifespan of women in first world countries like Australia and the US is like 84 or something. So that's like a third of their life. It's not like I'm 50 and death is around the corner. It's like, I have 30 years here. Am I going to just take this? Am I going to be miserable? Am I going to just never have sex again? And I think more and more women are saying, no, that's not how I choose to do this. I want to start a new career, or I'm about to start dating again. Online dating has changed everything because now you can be a divorced woman at 55 and go find partners, life partner or sex partners or whatever you want, pretty quickly and pretty easily. So I think women are realizing, if I'm going to put myself out there, I want to own my health. I want to own my sexuality. And what I hope is that they'll think, hey, pleasure is for me too. Sex is not just about pleasure for the partner with the penis. Pleasure is for me too. So if you're straight, it's understanding those gender roles and owning pleasure for yourself. If you're not straight, that's fine too. It's still about what gives me pleasure and how can I speak with my partner openly about that. But I find my lesbian couples are so much better than my straight couples at communication. My friends who are gay men are like, "Are you kidding? Of course we talk about it. We want to know what the other one is turned on by." But for some reason, heterosexual couples, some of them are just stuck in like the 1950s or something, where you like slide into bed and try to get it over with. And, it's like, guys, come on, we can progress past this. So.
Yeah, it's really interesting. It's like with straight people, and I mean straight couples,
Yeah.
we see kind of these scripts in porn or in movies and books, and we're told that this is kind of how it goes, and the penis goes in the vagina, and that's kind of the only real sex, and maybe there's
Yeah.
foreplay then penetration, and if
But the
the penis
woman's
only
supposed to
orgasms, it's
orgasm.
done. Yeah, but then with
The
queer
woman's supposed to
couples,
orgasm in 5 seconds
oh
from penile.
yes,
Five
yeah, which is
seconds.
so far from the truth.
But then men internalize that, some straight men, and they really expect that that's what should happen. And they're confused when it doesn't. So they bring these women to my office and say, "Can you help her? She's broken." And it's like, oh my God, she's not broken. You've been fed these stupid messages that are misleading to you. I mean, in
It's
some ways,
society that's broken.
yes, I think in some ways we failed men by saying, here's what it is to be an ideal man. Just have penile penetration. She'll have an orgasm. You'll feel proud of yourself. And then you can orgasm and then life is good. And it's like, oh my gosh, so that's why some female porn directors are really disrupting the industry in such a great way. Erica Lust,
Yeah, I
Lust,
love her work.
right? And she did a great TED Talk, by the way. I totally would say put the link to her TED Talk somewhere. It's so, so well done. I thought it was really well done. So, anyway.
Yeah, I think too, I guess with what we were touching on there and that difference with queer relationships, how
Yeah.
queer people aren't necessarily given that script like straight people, so they have to talk. They have to go,
Yeah.
how are we going to have sex? How do we want
Yeah.
this to look? So then from the get go, they're already talking more, so then it's not as foreign. Whereas I think back to my first time having sex, it was kind of just like, where's the condom? Like, and
Right.
we
Right.
just kind of go into what we think it should be and are not actually talking about how do we set this up? How do we actually want this to look? What is sex?
Well, you've never seen that on
Yes.
TV in a movie. You've never seen a 16-year-old girl and a 16-year-old boy say to each other, what do you think would make for a really mutually pleasurable experience? Like, I guess maybe that would be too boring, but that kind of, and certainly no one in school has a sex ed class where they role play like that, which would be so cool to have like progressive sex ed so that as people begin to be sexually active, they could be comfortable talking about it. So, fantasy world, I'd love to just totally upend sex ed. There are countries that do it really well, like the Netherlands. They begin sex ed at age 4, right? And
Yeah,
so
which is
age 4, they do
amazing.
basic stuff, and then 7, and then 11, they do a little more. And it's not fear based. Like in the US, so much is, I think, very backwards. It's don't have sex because you'll get pregnant and that's the worst thing that could happen to you. Or don't have sex, you'll get an STD. In other words, sex equals bad things. And just telling teens to not have sex is so useless. That's never worked in the history of humans. And I think the Netherlands, it's more a pleasure based rather than fear based kind of thing, right? Let's learn how both parties can have pleasure. So smart, in my opinion.
I know. I know. I wish we could have that applied to the world like instantly.
I think it's so cool for people to know what's happening, to know that as women age and there's fewer blood vessels in the vagina, they can't make the moisture as easily as before. You need blood vessels for moisture. So without those blood vessels, which start to leave with menopause, you can't get wet no matter how aroused you are. Um, and I think the important thing is to understand that when women use vaginal estrogen, which is available in Australia, it actually creates and replaces those blood vessels. So you get them back again. You're literally turning back the clock. And by the way, this can happen not just from traditional menopause, my ovaries stopped working. If you have cancer and have radiation to the pelvis, or if you have a surgery that removes the ovaries, or if you have an autoimmune disease where the ovaries lose their function, you can be 25 and have this happen. So it can happen from medical or surgical reasons too. I hope not, but it totally can. And you will have, you won't mistake it. You'll know the dryness, the pain, the bleeding sometimes. So I think it's super important if you're not sure to go see a clinician and get checked out because it's so easy to fix. But even if you don't go and get medication, there are over the counter things. I mean, we all know what lubes are, right? And lubes are used in the moment. But there's something called a vaginal moisturizer, which is also over the counter. You can get it on the internet. And these are usually little suppositories inserted in the vagina like twice a week. And they last for about half a week and they just create moisture. So they're fake, they don't make new cells, but they do make everything very moist so that sex can be comfortable. And you don't have to just use them right before sex. It's like the moisture's there for half a week at a time. So that's kind of cool. The most effective vaginal moisturizers have an ingredient called hyaluronic acid, which we should link to. And that's something we use in high end cosmetics to make our skin feel more moist. But you can actually use it in the vagina too, and it does work. So, there are options to get around this lack of estrogen and lack of blood vessels. So I think that's important to know. The other place we really need blood vessels and nerve endings is the clitoris. The clitoris
Mm.
has the most nerve endings of any part of the human body, male or female. It actually has more nerve endings than the penis. Not to be competitive, but it does. So there. Um, and we know that if orgasm becomes diminished or kind of wimpy, or women are having trouble achieving orgasm or having an orgasm of the same intensity that they used to, that using a little bit of topical testosterone, like testosterone cream, which again you can get in Australia, on the clitoris itself tends to create new blood vessels and new nerve endings. So this is phenomenally helpful if you're someone who, for whatever reason, just can't quite get there or used to have orgasms and now you're not. So these are just kind of, doctor hacks, if you will, for ways to kind of turn back the clock and help restore moisture or orgasmic potential in humans with vaginas who are struggling. Testosterone can also be used on the skin, and it gets to the brain for libido help, because loss of libido, Emily, as you know, is the most common sexual dysfunction that my patients
Yes.
report to me. I just
Yeah,
don't
same.
care. I don't care if I ever have sex again. I'd really rather just watch TV, you know. And that's, I think, something worth addressing and fixing. Is it a relationship problem? Is it a self esteem problem? I don't like my partner to see me naked. Is it a medical problem? I'm on a medication that's killing my libido. Antidepressants are big culprits of this, and they're prescribed
Mm.
very widely in the US. I bet they're prescribed in Australia
Yes, they
pretty
are.
widely too. So, you know that, of course, that people on antidepressants are, I mean, sort of their emotions are being softened, bad and good. And that includes things like desire for sex. So we need to circumvent that. Sometimes we do it with a medication, sometimes we do it with something called bibliotherapy. Have you talked about bibliotherapy on this
No, I
podcast?
haven't.
So, biblio is the Greek word for book, and bibliotherapy refers to the fact that if we bring erotic content into our brain, whether it's through reading a book, watching TV, watching a docuseries or a movie, or even listening to erotic content, which I'll talk about in a second, the female brain stores that almost like a savings account. So this is a big relief to my patients because they're like, it's Friday night. My husband always wants to have sex Friday night. I'm tired Friday. I don't want to have sex Friday. Fine, don't have sex Friday. But read books with juicy content. Watch stuff on TV so your body's seeing couples making love. Whatever version of a couple is exciting to you. And even for straight women, sometimes watching sex with queer couples is more exciting, or vice versa. It doesn't matter. You're allowed to be turned on by whatever you like. That's the beauty of, if there is a good side to internet porn, it's that it's private and we can pick what we like. And the other form that a lot of women love is what we call audio porn, or as I call it, oral sex, AURAL, oral sex, because these are apps that you can download and find stories that are arousing to you. You can put some headphones on, lie in bed after a long day of work, and listen to a story, corny or silly, or whatever fantasy you like. And whether you masturbate or not when you hear that story doesn't even matter. It's feeding erotic content into the brain. And then when you go to put your head on your partner's chest, or someone stroking your arm, or the most G rated thing, it can take on a sort of magical, more erotic um, context, if you will.
Mm, mhm.
And for some women, that's how they kind of can either resurrect a sort of dead sex life, or begin to have sex be something that's part of their every week, not just, oh my God, we're going on vacation. I guess we're going to have sex. Because I don't want you to dread it. Emily doesn't want you to dread it, right? We want you to embrace it. And we have to get sexual content into the brain before we can worry about what happens genitally, I think.
Yeah, I
What do
think
you
that's an
think?
awesome way to approach it, and I think it's a it's pretty accessible. Like, it's a pretty, like, kind of, in my mind, easy way to kind of go into it. It's not
It's cheap
jumping
and
in, I need
easy
to
and
have
private.
sex. Yeah,
Yeah,
yeah, absolutely. I know I saw some research that it said that reading erotic books can be as effective as reading books that are non-fiction on sex, like trying to learn about sex and how to improve it, that it can have the same impact on your sex life. Because as
exactly.
you kind of, as you just said, that just having a more erotic mind, it being more
Hmm.
accessible instead of being something that's just completely shut off from your life, and then you have to somehow once a week or
Go
once a month,
from zero
whatever
to
it is.
60,
Yes, it's
right?
like that's
Yeah.
such a big jump. Of
Well,
course that's
that's a,
going to be difficult to get to.
exactly. And men are better at that jump than women. They are. We know this. Data has proven that. If you put a man and a woman who have zero desire at 12 o'clock in a room and say, go have sex, men tend to be more able to get an erection and have the sex, especially younger men. Remember, their testosterone levels are 10 times that of women, at your age, let's say. Um,
Mm,
so that brings me to another really good topic or point, Emily, which is the difference between spontaneous desire and receptive desire, right? Because so many of my patients come to me and say, I don't have any desire. Can you just give me desire? And I tell them, guess what? You don't need to have desire to have sex. And they're like, I'm confused. What do you mean? And it's because of this concept of receptive desire. When you have, you may as a woman not have desire, but once you start kind of kissing or fooling around or just even gentle snuggling or petting, you sometimes become aroused. And once you're aroused, desire can develop as a result of that arousal. And many people honestly don't know about this, have never heard about
mm,
this.
mhm.
You have, of course, because you're a sexologist, but I think it's one of those things that it gives women permission to not feel the pressure to have desire in the first place at the beginning.
Yes. And people think of desire like hunger, like it's got to be this feeling that just comes up, and it's like hunger. It's meant to be, this natural thing that should just happen. And then when we're hungry, we act on it and we eat what we want to eat. And I think people really think of it like that. So then when they're not getting the
Yes,
hunger feeling, they're going, oh my God, I'm never hungry. I mustn't want it. So if
right.
I like, and what do I do with that if I don't get that feeling? But knowing that your body can engage with this and then your mind can follow. And it's like the types of sex when people go, oh, I wasn't really in the mood, but that was actually really good. I really enjoyed that. We should do that again.
Right. And that communication's so critical to tell your partner something you really enjoyed. I think that's so key. I think also the appetite and food analogy is so great. Think about, not that we want people to go out and overeat, but think about you're not hungry, but your friends have brought over a pizza or something and you're really not hungry, but you take a bite and another bite and then you realize, I guess I am kind of hungry and I'm enjoying this. And
Yes.
I think with desire, if women in particular, like humans with vaginas, if they'll give themselves some grace, give themselves a break, and say, you know what, I'm just going to kind of sit on my partner's lap and tell them about my day and cuddle a little bit. And if they've been reading their book, their bibliotherapy, or watching, even just sitting with their partner will feel somewhat erotic. And that sometimes that can lead to very gentle, like sexual play. It doesn't even have to be genitally focused. And I find a lot of people come to sex that way, and it's very enjoyable because they don't feel that performance pressure, you know?
Yeah, I think too expanding the definition of sex for people can be really helpful because
Yeah,
people will come into session, they go, well, I don't have sex with my partner and I need to have more sex, or I want to have more sex, but they're talking about one specific type of sex, like penetrative sex. And then when they engage in oral sex or fondling or in other ways, they're going, well, that's not real sex. And then dismissing all these other times that they're being sexual with their partner because it doesn't feel like the real deal or the real thing. But it's like, you're still
right.
being sexual in other ways. Let's
Yes.
lean into that. How can you
Yeah.
expand your definition so that you do then feel connected with your partner in these moments and they can feel like enough, and that it doesn't have to always be this one type of sex that we're sold that it should look like?
Exactly. Exactly. Emily, you should do a podcast. Oh, wait, you
Yeah.
already. No, but I think that's a really important message. And especially when we think of sex in people with disabilities, right? There's
Yes.
people with
Mm-hmm.
disabilities cannot always do the same positions that they see in the movies or that they did before their disability happened if they developed their disability later in life or something. And this can be very disappointing. This can cause relationship breakups. This can lead to feelings of failure or whatever. And that's so. So I think um, differently abled people really, really need to understand a broad definition of sex and to absolutely erase that whole sex equals penis and vagina, sex equals me in this position and my partner in another. And there's a website, OMGYES, right? You probably know
Mm-hmm.
about it. And they have
Yes.
all these videos, and they're real people telling about how they had an orgasm or how they did sex in this or that position. And it sounds so weird or strange, but it's actually refreshingly authentic. And it's so helpful to people who really want to understand, that their sexual vocabulary and their definition of sex is really limited. So it's very,
Mm.
I find that's a nice resource. Do you have other resources that you send your
I
clients to?
do love that one. I guess for when it comes to exploring different types of sex, I wouldn't say they're necessarily resources I send them to, but more homework or home fun I get them to do.
Yeah,
And
me
really
too.
around pleasure mapping or sensate focus and really getting into your body and trying to expand touch outside of the genitals and how your body can experience pleasure in different ways all over your body. And
Perfect.
I've just really trying to strengthen that mind body connection so that then when we do experience sexual experiences that are different to just penetration, we can maybe lean into them more, find them more enjoyable, be present in our bodies. Things like oral sex, for instance, I find so many women will come into my session to go, oh, that's just one sex like I can't do. Like, I'll try it to, because my partner wants to, but I just can't stay in my body, or I feel really insecure, and all of these different messages that can kind of come up for them. So I find that trying to just get comfortable with being in your body can be
Yeah,
a really great place to start, depending obviously on what's going on for someone.
for sure. For sure. That's such a great thing. In the US, we we used to have this rating system. I guess we still have it for movies. G rated was for kids and PG parental guidance and R restricted under the age of whatever, and X was like the really racy stuff. So when I was a kid, that was always like, ooh, what movie had you seen, at 13 or 10 or whatever. And I tell a lot of my patients that when they're starting a new relationship or they're having trouble getting up the courage to have a sexual relationship, maybe they had surgery or maybe they're widowed and this is their first time back having sex, or divorced, or they were a victim of trauma for whatever reason, right? And so we start G rated, just like you're saying. we say no genital touching, just touch hands, arms, toes, face, whatever. And then you can move to sort of the PG areas, the breast or the inner aspect of the thighs, or things that feel really good to be touched but aren't genital. And then from there, you can do genital touching, and you sort of are saving penetration for something that you're ready for because you're turned on because you've had the other sort of levels, and I think that's another way of saying exactly what you said, to sort of
Mm,
de-emphasize penetration as the be all end all, because so many people feel that that's some mark of sexual achievement or something, as
mhm.
opposed to just, I had a wonderful time with you, or I
Yeah.
loved how we just cuddled or talked, or I loved just giving you pleasure and not having any myself. It didn't matter. Or I loved oral sex. I mean, yeah, oral sex is a tricky one, because it really requires that women say, I'm comfortable. I'm comfortable with who I am. I'm comfortable with what I look like down there, what it smells like, tastes like, whatever. And so many women are so almost embarrassed about the way they
Mm,
look, because I think there's just sort of one right way, which
yeah.
again, I think porn has done a big disservice here, right? And there's actually like a coffee table book that's been published in the UK with just like 500 vulvas or something, just showing that all these variations of normal are normal. That,
Mhm.
whatever
Mhm.
you are is beautiful, and it's just you, you know.
Yeah, which
Um,
is important for people to see because I have many clients who have come to me and who still do that are so ashamed of how their vulva looks because they've been told that it needs to be this. The word that comes to my mind that they often use is Barbie like. Because when you look at a
right
Barbie, there's nothing. You don't really see anything there.
there.
There's no labia, and then
Yes.
in porn, that's often the types of
Yes,
vulvas we'll see too.
many of those women have had the labia cut off to give that
Yes.
Barbie look. And the sad thing is that I think a lot of women don't realize that the labia minora, the ones that are trimmed to look like Barbie, actually have sexual function. They're not just these
Mm,
floppy lips hanging around getting in our way of our bathing suits or whatever. They actually are full of blood vessels and nerve endings. They're receptive to estrogen and testosterone. So they're really actually a part of a sexual response.
mm,
And so to trim them to look different, you're actually hurting your own sexual response. And I don't think most people know that, or they wouldn't do that, you know.
yeah.
Um, and anybody who tells you, well, my partner wants me to look like that, I would say maybe it's time to get a new partner, or at
Mm,
least have a conversation with your partner saying, you know what, this is who I am. This is what I was born with. My feet are also slightly different size, and I'm not planning to cut my toes off. I mean, we all have imperfections in whatever stylized idea of Barbie like beauty is out there. And I think it's really important to embrace those imperfections, including in the vulva. I mean, nobody should be saying to anybody like, well, I would rather have sex with you if your labia were perfectly matched, or really tiny and not there. That's a problem for someone thinking that. And that's,
mm,
again, probably porn,
mhm,
that's led to that stylized Barbie image. There are plastic surgeons in America that even call that a Barbie procedure, where they offer a version of labiaplasty called the Barbie.
it's so
So,
bad.
and we know that that can be botched and done so aggressively that
Yes.
actually the hood of the clitoris is removed, and then people can have terrible sexual pain from it. So it's not something to joke about in terms of, well, what's the big deal? Trim a little tissue. It can have really devastating sexual effects, and you
Mm,
can go from wanting to have slightly more cosmetic vulva to having terrible sexual pain, and really kind of destroying your ability to have comfortable sex. So in America anyway, some studies have shown that most OBGYNs are not actually technically trained to do it.
Yeah.
So I would say definitely if you're thinking about that, in Australia or whatever country you're listening from, make sure that you have a really clear discussion with the surgeon about exactly what's being taken off and what is to be left alone. Because I've seen
Mm.
some disasters. Patients come in and say, Dr. So and so took too much off and I'm in agony now. Can you put it back on? And
Mm.
no, we can't really.
Yeah.
Um, so it's worth not to be Debbie down, to get sad about it, just to understand that it's labiaplasty is in the U.S. very popular, very high demand procedure, and for many people it's done and nobody has any problems with it. But for
Mhm.
some, it's the cause of real kind of trauma, real
Yeah.
physical trauma.
Yeah, which is so important for people to know about because you need to be informed when you're going to make decisions like this. Any
I think
surgery,
so.
any
Don't make
medical
it.
enhancement, whatever it is you're doing, you need to be
Yeah,
so informed. And I think with social media and just being able to search on the web, we can quickly go down these spirals and be like, oh, this is what I need and this is what I need to change
yeah,
about myself without really
yeah.
understanding, well, what happens when I take this path?
Yes, yes. Thank you so much for giving me the airtime to say that, because I think I get to see the bad news. I mean, there's plenty of people that are really happy with their outcomes, but honestly, when it goes wrong, it's really hard to correct. So it's
Mm.
really not something to be taken lightly. And honestly, when they do studies and ask, most people, men and women, who are having good sex with their partner are not thinking, well, I'm having great sex, but if only her left labia was a little smaller. Nobody thinks that. So whatever path you're going down, thinking this asymmetry or this extra tissue is is embarrassing or the cause of me not having a great sex life, it's actually not what your partner's thinking in general. I mean, it's the
Mm.
same with weight. They did a study many years ago on women who weighed, I think, between 350 and 400 pounds. So I don't know, 150 or 200 kilos. And they asked their partners, does her weight bother you? Are you less turned on? And the most common answer from the partners was, what issue? I'm totally turned on by her, which should give people, I think, a sense of, what? This person loves being with me. This person is sexually attracted to me. And whatever it is about me, short, tall, brown, white, straight, not whatever it is, the qualities of me are attractive to this person. And not, oh, if only I had bigger boobs or Barbie labia, Barbie vulva, or weighed less. I thought when I read that study, I was really, it hit home, that whatever
Mm.
version of we bring to a bedroom, that person is already telling us, I want to be with you,
Yes. Yeah.
I
And if
think.
we think about it ourselves, like when I'm never thinking about how my partner looks during sex, going,
No.
oh, that look at that bump, that wasn't there before, or whatever it was. You
Yeah.
know what I
Oh,
mean?
I
Like no
wish they
one's
didn't have that mole on their back, or whatever. It's
yeah,
like,
no, we're in our own bodies thinking about the pleasure we're experiencing and even just
right.
the skill of sex, like trying to do a position and like putting your body in that way. Like we're not
That's right.
thinking about how our partner's looking. Or I'm finding a lot of my clients will be thinking about themselves and they're not experiencing pleasure because they're so caught up in how am I looking right now? What's my facial expressions like?
Right.
Do I have any tummy rolls? If I
Right.
orgasm, what's that gonna look like? And
What
just,
does it
or am I
sound
even going to
like? Yeah.
orgasm? Like, just
Yeah.
so in their
Yeah.
heads.
Which is another reason to de-emphasize orgasm, so that people can just
Yes.
say, hey, pleasure is what I'm doing. It's not
Yeah.
whether I achieve orgasm.
Pleasure is the
Um,
measure.
Pleasure is the measure, right?
Yeah.
And communication
Yes.
is lubrication. So
Yes. Yes. I
look
love
at you. And
that.
yeah, we're going to get those printed out. But
Yeah.
it's so true. And I think that so the bedroom gap, it would be good for everybody to know the definition of the bedroom gap, because it's now being used academically in psychology classes to teach psychology students about some of the sort of sexual psychology of sexual dysfunction, some of the psychology behind sexual dysfunction. So the bedroom gap is a term that I coined, which means really the difference in sexual expectations and abilities in that seem to get worse in midlife. Yes, between um, cisgendered men and women, but also between LGBTQ couples, between pretty much anybody. Because, as we said at the beginning, with age, whatever your gender is, there are changes in the body. And so a woman might assume a man can just keep the same erection he had at 25 and ejaculate and be erect again in 3 minutes and da da da. And that may not happen with age, often doesn't. A man may assume that a woman can get wet and have, 8 orgasms like she did when they were in their 20s, and now she doesn't even want penetration, and he's confused why. And again, they're not talking about it. So this gap in performance, in ability, and in communication can really be relationship wrecking, self-esteem wrecking. And I thought it was important enough that because I felt it was quite ubiquitous. And so that's why I pitched the idea to TED, and they accepted it for a talk, because they also felt that it not only was universal and not only super common, because there are 500 million menopausal women in the world today,
Mm.
but they felt that it was sort of a proxy for the gendered healthcare gap, that men and women aren't getting the same care and healthcare, and sexual health is always under discussed and treated among doctors. So, that's why I thought it was important too. So I want your listeners to know what the bedroom gap is. When you look at, I just watched a movie the other night called Baby Girl with Nicole Kidman, and
I need
right,
to see that.
she's like this powerful CEO, but she and her loving hot husband have for the past 20 years been sort of living a fake sex life, in that she just fakes orgasm, even though she's a woman who outwardly, to you and I and anyone, you'd say, wow, she is badass and she's top of her game professionally. She's gorgeous. She's a beautiful dresser. She's got a beautiful home, hot husband, kids. Like she's someone who gets what she wants, except she doesn't sexually. And she feels weird and guilty that she can't talk to her husband about it, and he doesn't have a clue, because she's an excellent actress, both on screen and maybe in this movie anyway.
Mm-hmm.
So it's really about the bedroom gap. That movie is about what happens when you have a bedroom gap that doesn't get communicated. And in this case, what
Mm.
happens is an affair, spoiler alert. But and I think, gosh, I also just saw Disclaimer, which is a like 6-part series with Kate Blanchett, the British actress. Oh my God,
Mm-hmm.
she's an amazing actress. But same thing. She and her husband have some long-standing sexual issues, and because she had an affair in her past, she feels too guilty to bring it up with her husband now. So again, bedroom gap now in their 40s and 50s, because of something that happened to her 20 years ago. So, I mean, this is why more people need to talk with people like you, Emily, because they need
Mm.
to feel that they can say something's not right and I don't know how to talk to my partner,
Mm-hmm.
and work through it with you or with me, or role play, or read my book that's coming out this winter, or listen to your podcast more. But
Mm-hmm.
I think it's a real thing, and I think it happens to people in the city, people in rural areas, brown skin, white skin,
Everywhere.
wealthy, not wealthy. I mean,
Mm-hmm.
you know, I've gone all around the world last year to different countries trying to ask women about this. And it's almost getting boring, because they all experience it,
Yeah.
whether they're in France or Morocco or, Paraguay. They're all like, yeah, of course I have this. Of course I can't talk to him about it. Or of course I can't
Mm.
mention it to her. I don't want to hurt her feelings. So until we talk about it, we don't get the sex that we want. And I guess that's what I want for the people who listen to you and I.
Yeah, and for something that's such a universal experience, it's wild that we aren't talking about it. Like, it's so wild that it is not something that we are able to talk about, like our finances, like if you're raising children or what work, whatever's going on in your life. We're all well, a lot of people are experiencing this or have at least in a relationship, and it feels so foreign to talk about and to then bridge that gap and become
Yeah.
closer and not so mismatched.
So how can you and I help people close that gap? I think it's from trying to help destigmatize and take the shame away. And I
Yeah,
think shame
absolutely.
and sex for women in particular have been cousins, twins
Mhm.
for centuries. That, there's something wrong about women who are comfortable talking about sex. You're either slutty, or you have I don't know, I mean, maybe you can educate me on where does that shame come from. But I think it's history sort of, and
Yeah.
culture,
Yeah,
right?
history, culture, we're not taught about our pleasure in the first place. So then how are we meant to talk about it? I mean, I never learned what the clitoris was or the actual full structure even until I was studying to become a sexologist. Like these are all we're not given the knowledge in the first place, and we're kind of just expected to know what's happening in our bodies, but then we don't. And we're also told that if we are sexual, that that is shameful and that we should only be sexual for
Yeah,
one partner, and that if our
right,
sex looks different compared to just your traditional vanilla kind of sex, that that could also be shameful. And it can be told from our family. Our parents might not want to talk about sex. If they did, it was just kind of fear-based education. And I think because there isn't this openness, then we're kind of told, well, we can't talk about this, and if you can't talk about
right.
something, you internalize it. And I think that's where a lot of shame can come from. Also, when we look at movies, porn, it's sold to us as one way. So if we don't feel that way, or if our sex doesn't look that way, then we can feel shame because we're going, well, we're not doing it right.
And look at the messages around masturbation, right? That
Yes.
masturbation for men happens, teenage boys do it, ha ha ha, jokes on TV, the
Mm-hmm.
teenage boy, don't come in, mom, da da da. But the girl, not you,
It's not
you're
even
just not
mentioned.
supposed to, not even mentioned.
Yes.
My friend from Ireland went to a strict Catholic school in Ireland and was taught that masturbation was as bad a sin as murder. Sounds like a joke or something, but this was
Mm-hmm.
in the 70s. This wasn't 500 years ago. This was in the 1970s. So if you're giving teenage girls that message, of course they're not going to feel comfortable talking about it or doing it or trying it or
Mm-hmm.
finding out where the
Yeah.
clitoris is even.
Yes.
So in my office, I have to show you a picture sometime. I have in every room little velvet puppets of
Mm-hmm.
vulvas that this woman makes. They're so great. And I show them to every patient, and I'm always shocked how many of them are like, "Could you just? I mean, is that what? Where is it? Is it that? Is it there? And it's like I can't believe this is the first time anyone's doing this with these women.
Yeah.
Some of them are
Yeah.
60 years old, and
Yeah.
it's like so. Yeah,
Well, if we think about
more room for
genitals
you and I to
too,
learn. What?
yes, and we think about genitals too, like people with penises, you can see it. It's kind of just sitting there. If it gets an erection, you can go, "Oh, I'm getting an erection. What does that mean?" But with a vulva, it's not as out in the open. You have to go and get a mirror and really look and search and understand what's going on and label. And I think even then with arousal, women sometimes don't even know, how do I know if my body's getting turned on? Because they don't have
That's
this like
right.
kind of obvious sign like an erection, for example. So then I think that can also lead into some of this shame because we don't even understand our bodies or can't even
I
look at our
know.
vulva or touch our vulva because we think it's something that's kind of
Shameful
yucky
or
or icky.
dirty or
Yeah, yeah.
I know. And anyway, we change it one listener at a time, but I've loved talking with you. I feel like this is so important. These are really important things for people of any age to learn. You're never too old to take a mirror and look and try to understand what's there.
Hmm.
There's a nice book in the US called Come As You Are by
Yes,
Emily
that's like my
Nagoski,
Bible.
and I give that out to young women all the time, sometimes to older women too. And my book will have a nice chapter on how similar men's and women's anatomy is, just most of ours is internal. The fact that the clitoris is actually about 8 centimeters in size, it's big. It's just almost all inside. It's sort of like an iceberg, right? We're just seeing the tip above the water, but there's a lot inside. And that we have erections too. I mean, who knew that, right? You'd think
Mm-hmm.
everybody would, but we don't really get it, I think.
Yeah. Yeah.
Anyway,
No,
so
exactly.
yeah.
Now I'm conscious of time. We've gone over, but I have a final question for you that I ask all of my guests. What is something that is orgasmic to you?
What is something that is orgasmic to me? Orgasmic to me. Oh, wow. Huh. I mean, metaphorically or really? Like,
Well, it can be metaphorically. Most people say something that's like a bit more metaphorically, but
yeah.
it can be whatever you're comfortable sharing.
Yeah, yeah. I mean, metaphorically, orgasmic to me is some of the absolute splendor and stunning, mind-blowing stuff in nature that I see. Going out to Uluru and seeing the desert around there, driving the Great Ocean Road, just seeing some of the incredible natural beauty in Australia and in the US is metaphorically orgasmic to me. I think I'll keep the really orgasmic stuff to my husband. But thank you so much for having me. I've really enjoyed it, and look forward to the next time I'm back in Australia, and maybe we can meet up live. That would be great.
Yes, yes, I would absolutely love that. And just before we finish up, is there any links or anything you would want to share with the listeners?
Yes, I'll send you links to my website because on that website, listeners can find me. I have patients all over the world, and this way, if people want to have a connection or a consultation or just watch some of my other podcast appearances, they can. They can also look to pre-order the book that I've written called The Bedroom Gap, or if they just want to spend 14 minutes, they can watch the TED Talk, which I think is pretty funny. So they should get a kick out of that. That's about it.
Amazing. Well, thank you so much for coming on and sharing your knowledge. And yeah, I can't wait to chat with you again.
All right. Thanks, Emily.